Have you ever walked into a clinic for a routine checkup, sat through a long day of prep or scanning, and gone home feeling more worried than when the day began? It's a common story after 70. The truth is, medicine is powerful, but not every test is powerful for everyone at every age. Bodies change, risks change, and the balance between help and harm changes too. This conversation is about feeling safer and smarter, not scared. Together, let's talk through 5 checkups many older adults can skip, when they still make sense, and what to ask so every test genuinely serves health and independence. By the end, there will be a simple way to talk to a doctor about whether a test will change care or just create stress. Let's start with the one many people know well. Colon cancer screening saved countless lives for decades, and if there's been no screening before 75, it can still be worth discussing. But after 75, the balance shifts. Colonoscopies require strong laxatives, fasting, and sedation, then a camera travels the length of the colon. For some, that's routine. For others, prep can trigger dehydration and weakness, and the procedure can rarely cause bleeding or a tear. Leading guidelines say screening up to 75 offers clear benefit, and beyond that, it should be a careful, individual decision, with most people stopping entirely by 85. If health is robust and screening history is incomplete, a doctor may still suggest it. If health is average and prior tests were clean, a stool test at home can be a gentler path, or the conversation may land on no more screening. The key question is simple. Will this test meaningfully add years or confidence, or will it mostly add risk and recovery time? Hearing a clinician say, given your age and past results, the benefit is small, is a sign it's okay to choose less. Now, imagine sitting for a quiet X-ray of the breast. It's quick, often covered, and for many years it was a habit to continue indefinitely. What changed is our understanding of overdiagnosis in older women. Screening finds more cancers with age, but a large share are so slow-growing they would never have caused trouble within a normal lifespan. That sounds odd, a true cancer that never harms, but it's real. And it matters because every finding usually triggers biopsies, surgery, radiation, or pills that sap energy and joy. Studies following women in their 70s into their 80s suggest roughly 1 in 3 to 1 in 2 screen-detected cancers at those ages may be overdiagnosed. That doesn't mean screening is bad. It means the benefit depends on overall health and years ahead. If someone is strong, active, and wants to continue after a thoughtful talk, that's reasonable. If energy is precious and there are other medical priorities, it's also reasonable to stop. A helpful way to frame it with a clinician is, given my health, is screening likely to help me live longer or live better? If the honest answer is probably not, permission to let go is evidence-based, not giving up. Now, switch scenes to the cardiology lab. Stress testing sounds reassuring. Walk on a treadmill or get a medicine that makes the heart beat faster while machines watch for trouble. When chest pain on exertion is new or worrisome, this can be an important tool. But when there are no clear heart symptoms, stress tests produce a lot of noise. In older adults, false alarms are common, and those alarms can send people down a path to angiograms, stents, dye exposure, bleeding, and hospital nights without living longer or feeling better. Cardiology leaders have been plain about this for years. Don't do routine stress imaging in people without symptoms, and don't repeat it yearly as a check-in. A better approach is to listen to the body. Tightness with hills, breathlessness too early for the effort, or pains that arrive with effort and ease with rest. Those patterns help a doctor decide if a stress test will change care. If there's no clear story, focus on the foundations that unquestionably help the heart at any age. Walking most days, small doses of strength and balance work, blood pressure control, and medicines that are proven to help reduce risk when indicated. Asking, if the test is positive, what would we do differently and would that improve my life, keeps care on track. Before moving on, here's a simple script to bring to any appointment and keep the conversation calm and clear. What is this test trying to find? If it finds something, what happens next? Are there gentler options that give us the same answer? And, based on my age and health, do experts say the benefits still outweigh the risks? Most clinicians welcome these questions. They turn a scary yes or no into a plan that fits the person in front of them, not a generic template. With that mindset, it becomes easier to see which tests are truly helpful now and which ones belong to an earlier chapter of life, when the balance looked different. That same mindset will make the next decision simpler too, because each of the remaining checkups has a similar theme: great tools in the right moment and the wrong tools when used out of habit. Let's keep this practical and steady, the way a good walk feels on a cool morning. A smart health plan after 70 is less about saying no to everything and more about saying yes to what truly helps. That mindset makes the next decision simpler. Cervical screening is a great example. For decades, Pap and HPV tests prevented cancer by catching changes early. Past 65, though, if screening has been regular and negative, continuing doesn't add much protection and can add a lot of worry. A swab that turns up an unclear result often leads to colposcopies, biopsies, and procedures that are uncomfortable and rarely change the long-term picture when prior tests have been clean. National guidance is consistent here. Stop screening after 65 if there's an adequate track record of negative tests and no high-risk history. That doesn't mean ignoring symptoms. It means trusting good past care and sparing the body extra pokes unless there's a real reason. If past results are missing or spotty, ask the clinic to help reconstruct the record before deciding. A helpful question is, do I meet the criteria to safely stop, or should we complete the record first? That keeps decisions calm and evidence aligned. Now shift to something many men have wrestled with, the PSA blood test. It's a tiny tube of blood that can open a very big door. When PSA is higher than expected, the next steps often include repeat blood work, MRI, and a biopsy. Those paths can find dangerous cancers in some people, but in men in their 70s, they also uncover a lot of very slow-moving disease that would never have caused harm in a normal lifespan. Treatment, surgery, radiation, or hormone therapy can bring side effects nobody wants, like urinary leakage and sexual dysfunction. This is why many expert groups encourage older men, especially those with limited life expectancy or other medical priorities, to skip routine PSA and focus on what improves daily life. If health is excellent and the preference is to know, it's okay to screen after a clear talk about what will happen if the number is high and how to avoid rushing into treatments that don't improve length or quality of life. A grounding question to ask is, if my PSA is a little high, can we watch carefully first and only treat if there's clear evidence it will help me live longer or better? That kind of plan preserves confidence and control. From there, let's look at a test that seems harmless because it's so simple: a urine check. In older adults, it's very common to have bacteria present without any symptoms at all. That's called asymptomatic bacteriuria. It sounds like an infection, but without burning, urgency, fever, or flank pain, it's usually just a passenger, not a problem. The trouble starts when a routine urine dip or culture is ordered just to check, comes back positive, and antibiotics are started anyway. Research shows that treating these positive cultures in people without symptoms doesn't help and can cause harm. Gut upset, C. difficile infection, drug reactions, and antibiotic resistance that makes future infections harder to treat. The better path is to skip urine tests unless there are urinary symptoms or a very specific reason, like preparing for a urologic procedure where bleeding is expected. If confusion or falls crop up without urinary symptoms, close observation and a full check for other causes beats reflexively ordering antibiotics. A wise line to use at the clinic is, since there are no urinary symptoms, can we hold off on a urine test and antibiotics unless something changes? That single sentence protects from a lot of unnecessary medication. Finally, for today, let's talk about the shiny promises of whole-body CT screening. The ads sound persuasive: one quick scan to find hidden problems. What they don't show is the cascade that often follows. CT uses ionizing radiation. A whole-body scan means a relatively large dose. More importantly, scans in people without symptoms pick up tiny spots and nodules that are part of normal aging. Once spotted, they trigger follow-up scans, specialist visits, and sometimes biopsies, each adding risk and anxiety without a proven payoff in longer life. This isn't just cautious talk.
Regulators and radiology groups have been clear about this, that whole-body CT for asymptomatic people has no demonstrated benefit and can do harm. A better approach is targeted imaging for specific symptoms or guideline-supported programs like low-dose CT for lung cancer in qualifying former heavy smokers. If a clinic markets a bundled scan, it's reasonable to say, "Show me the evidence that this helps people like me live longer or better." If they can't, the best choice is to pass and keep the body away from unnecessary radiation and worry. All of these choices share one theme: keep care personal. Ask whether the test fits the story, whether the results would change treatment now, and whether there's a safer way to get the same answer. That approach doesn't slow anyone down. It speeds the path to what truly works. It conserves energy for the good stuff: walks with friends, meals that nourish,
sleep that restores, and a mind engaged with things that matter. With those anchors set, the next piece falls naturally into place, because the last test on this list is less about pictures or pokes and more about choosing wisely when a heart check is actually needed and when it's better to keep moving and keep life simple. When the heart is the worry, it's natural to think the safest move is test everything. The safer move after 70 is test the right thing for the right reason. If there's new chest pressure with hills, breathlessness that shows up too early for the effort, or pain that arrives with exertion and fades with rest, that's a story worth evaluating, often with targeted testing decided together with cardiology, because symptoms and risk together guide the next best step, not habit or annual routines. If there are no clear symptoms, routine stress tests tend to raise more alarms than answers in older adults, sending people toward angiograms, stents, and hospital nights without living longer or feeling better, which is exactly why cardiology's choosing wisely recommendations say to avoid stress imaging in asymptomatic patients. A helpful one-liner at the appointment is, "If this test is positive, how would my treatment change? And would that improve how I feel or how long I live?" Because it brings the conversation back to outcomes that matter day to day. Stepping back, there's a pattern worth keeping. Stop doing tests just because they've always been done, and start choosing based on current health, past results, and what changes care now. That's why many people can retire colon cancer screening after 75 unless there's a special reason, save energy for things they love, and use lower burden options like stool tests when benefit is still possible without the strain of sedation and prep. It's why women with a solid screening history and a life horizon shaped by other priorities can gently set mammograms down after careful discussion, avoiding overdiagnosis and the treatments that follow when they won't add years or better days. It's why men in their 70s often skip PSA unless they're in excellent health, and even then, agree in advance to go slow if numbers drift up, watching carefully instead of rushing into procedures that don't improve quality of life. It's why PAP and HPV tests can stop after 65 when the record is adequate, because continuing adds little protection and more procedures, while staying alert to new symptoms remains wise. It's why skipping routine urine checks without urinary symptoms prevents unnecessary antibiotics, gut upset, and resistance, reserving treatment for the times it's truly needed. And it's why saying no to whole-body CT just to check is an act of self-protection, trading radiation and cascades of follow-ups for targeted scans only when symptoms or strong guidelines say they help. There's real comfort in a clear plan, so here's a simple way to decide with confidence at any appointment. Start by asking what the test is trying to find and how the result would change the next step, because tests that don't change treatment are often optional. Ask whether there's a lighter touch alternative that gives nearly the same information, like a stool test instead of colonoscopy for some older adults, or watchful waiting for a borderline PSA with no symptoms so the least risky path stays on the table. Check whether experts say it's time to stop, such as ending cervical screening after 65 with adequate prior negatives, because age-specific thresholds exist to protect from testing that no longer serves. Finally, bring life into the room by saying, "My goal is to stay independent, steady on my feet, and clear-headed. Does this test help with that?" Since the best care always points back to independence and joy, not just numbers on a page.
If a past routine is hard to let go, remember that stopping a low-value test is not neglect, it's precision, supported by national task forces, specialty colleges, and geriatric experts who spend their careers weighing benefits against harms for older adults. These same experts emphasize what never goes out of style: walking most days, small doses of strength and balance work, eating in a way that suits the body now, steady sleep, social connection, and medicines that are proven to help when truly needed, because these add both years and better days. Thank you for spending this time investing in health the smart way, with curiosity and courage rather than fear, and for being willing to ask better questions at the clinic and expect better answers in return. Share experiences in the comments. Which tests have been helpful? Which ones created worry without answers? And what questions made appointments simpler? Because stories help others feel braver at the next crossroads. If this guidance was helpful, tap like and subscribe, so more people can find clear, calm advice grounded in evidence and focused on living well right now, not just living long.